My name is Brittany Hardrick, and I'm going to talk to you about MRSA. Today, in my speech, I will inform you about what MRSA is, what are the symptoms of MRSA, and who is at risk for MRSA. I want to inform you about how a 19-year-old girl ended up with MRSA in the ICU fighting for her life. Everyone has MRSA and other bacteria in their body, but you never get sick. Lately, MRSA has taken many lives of young adults due to lack of education. I am qualified to give this speech because I have encountered many cases of MRSA from being a respiratory therapist. I am very familiar with this subject because I have attended many briefings and trainings on how to deal with people who have MRSA. By having the knowledge about MRSA, I was able to help this 19-year-old girl make it through her bout with MRSA. I have done a lot of research on this subject so I can better help my patients get through it. The purpose of my speech is to inform you about MRSA and how to protect yourself from getting it. In my speech, I will inform you about 1, what MRSA is, 2, what are the symptoms of MRSA, and 3, who is at risk for MRSA. First, I want to explain what MRSA is. It is an infection caused by Staphylococcus aureus bacteria or staph infection. MRSA stands for methicillin-resistant Staphylococcus aureus. It's a certain type of staph that's resistant to a lot of antibiotics commonly used to treat MRSA. MRSA can be fatal. MRSA infections occur in hospitals, nursing homes, and dialysis centers. Older adults and people with weakened immune systems are at most risk for healthcare-associated MRSA. More recently, another type of MRSA has occurred among healthy people. This form is called community-associated MRSA. It is responsible for serious skin and soft tissue infections and for a serious form of pneumonia. I have told you what MRSA is, and now I would like to explain some symptoms of MRSA. There are some general symptoms that you should be aware about. MRSA generally starts as small red bumps that resemble pimples, boils, or spider bites. They quickly turn into deep, painful abscesses that require surgical drainage. Some kinds of bacteria remain confined to the skin. Other times they can penetrate into the body, causing potentially life-threatening infections in bones, joints, surgical wounds, the bloodstream, heart valves, and lungs. Now that I have explained some of the symptoms of MRSA, you need to know who is at risk. There are several risk factors for MRSA. There are risk factors for both community-associated MRSA and healthcare-associated MRSA. Community-associated MRSA risk factors are young children because they don't have antibodies to common germ jets, participation in contact sports, sharing towels, living in crowded or unsanitary conditions such as military training camps, and in American and European prisons. Healthcare-associated MRSA risk factors are healthcare workers, recent hospitalizations, invasive devices, and recent antibiotic use. In conclusion, I would like to remind you that my purpose today was to inform my audience about the serious infection called MRSA. Today I talked about what MRSA is, what are the symptoms of MRSA, and who is at risk for getting MRSA. As I stated before, I feel qualified to give this speech because I have encountered many cases of MRSA through being a respiratory therapist, and I also researched this topic thoroughly. Remember, everyone has bacteria in their body, but being educated and asking questions is key to being healthy. Thank you.